89.9 KMOJ, today's R&B and throwbacks. I'm Glam Life Kim, and that was Mark Morrison with Return of the Mac. Right now, it's currently 5 after the 1 o'clock hour, and it is time for Minneapolis 360. And you know what, Anthony? It looks like I got a caller coming in. So while you're talking to the audience, let's see if that's our guest.
All right. Thank you, Kim. Welcome, everybody. This is Anthony Taylor, African-American Community Specialist with Business, gap funding measures. We also talked last week about the housing fund for folks and how you can access information around that. And all of it is COVID-based because we're in a time and a situation where that's the most pressing thing worldwide in this country. And specifically, this show is really based for Minneapolis people so we can get the correct information when needed. So, again, I want to thank you for today and being here. What I really want to do, too, today is talk about some of the basics and the information and updates that's going on with COVID. Every week we've talked about statistics and things that are happening in this city specifically. So I want to make sure folks understand and listen to this information carefully. First of all, COVID-19 is still on the rise in Minneapolis, so we really have to understand that we're in a pandemic. The latest numbers statewide for COVID-19 cases has risen to 8,579 cases, right? So out of those cases, 864 are in Minneapolis, right? So What is really, really, really upsetting is that 16% of those are African American. And in the city, Kim, that's 30% of African American folks in the state, and 16% are to be African American people tested positive for COVID.
Wow.
So we really, really have to take a lot of this information that people are giving to us seriously, and the warnings that we are having folks do. Again, we continue to talk about social distancing, washing hands, staying 6 feet apart, and continue those things, Minneapolis, because we are not reached our peak in Minnesota.
Wow.
And it's very, very important that we make sure that we're practicing these things. We also know, too, that the stay-at-home order is still going through May 17th. So Governor Walz will address that again on the 17th. And he will decide whether things reopen, maybe a modified version or an extended stay-at-home order continues. So it's just really disturbing that we talk about these numbers and it's affecting our community. So I want to make sure that I give you updated statistics on exactly what's going on in our city. Also, too, I just want to give some updates about some of the gap funding measures that happened for the last couple of weeks. And the city received over 7,800 applications with the housing and the small business funding. And those application deadline has came and passed. Calls are still being made to folks so they can be able to receive information if they received this gap funding before the end of next week. So I just want to make sure that folks know that calls are still being made to people if you have qualified. Also, too, with the stable housing emergency expansion program with folks with annual incomes of 30% or below. So calls will be out made to folks by the end of next week so we can kind of make sure, keep your phones on, emails, addresses, and everything up to date. If you have not qualified and you receive notice that you have not qualified for any of those measures, you're able to call Hennepin County for more assistance. And again, that number is 612-348-3000. Again, 612-348-3000. And before I bring my guest on, I just want to talk to Kim real quick and just get a little insight on how you feel about this when you hear the numbers, Kim, that continue to rise in our community.
Yeah, it's scary. I think, it was a little reassuring at first because we were probably one of the states that had the lowest amount of cases. But now as we continue to see it go up and double and, it's real, you guys. So we just want to make sure that everybody is still, still self-quarantine, still, do what you got to do to try to stay away from as many people as possible, of course. And, we understand, there's family and there's different things that's happening, but we still want to abide by the rules and try to, make our cases as least as possible. One other thing, Anthony, is that I did notice that unemployment now for those who are self-employed. So I just want to remind anyone who may be self-employed that's having a hard time right now, if you're a hairstylist, if you own your own business and you don't have any type of income coming in right now, unfortunately, because you can't do hair or whatever it is that you do, make sure that you guys sign up for unemployment. Even if they say that you don't receive anything, just keep applying every week because you may get something. I mean, there's, I think, $600 a week right now for those who are self-employed. And it's been, people are getting it. So, you know, if you're struggling and you know that you're self-employed, get the assistance that's out there. That's what it's here for.
And that's a great point. And we talked about that, too, last week, that if you are self-employed, there is money. So please file in unemployment. You can do that. And that's a great point, Ken. And thank you for raising that, because there's a lot of small business folks out here, barbers, hairstylists, that really are struggling at this point in time because they can't open their shop. So that's a great reminder. Do we have Luisa with us?
Yes, she is. Luisa, are you still there?
Yeah, I'm here. I'm so sorry for getting delayed.
Oh, that's all right.
Yep, and thank you for being here. We got a lot of information that I want you to give folks. So Luisa is an epidemiologist from the Minnesota Health Department, and we're going to kind of talk a lot.
City of Minneapolis Health Department.
City of Minneapolis Health Department. Thank you for correcting me. First of all, can you tell folks what exactly is an epidemiologist?
Please.
And kind of go over, yes, and
Sure.
kind of go
An
over
epidemiologist
what
is
COVID-19
someone that
is.
studies the disease in populations and the cause of disease, and so from a population perspective. So in at the city level, our population that we are looking at is the city, and so we do we do investigations on cases of infectious disease. We look at the data for the population on births and deaths and in different areas to look at to look at what needs to be done to prevent illness and in the population, and what are some measures, public health prevention measures that we should be taking in general. Obviously right now very focused on COVID-19.
Yep, and so talk a little bit about what do we know about COVID specifically.
So, we know that it's caused by a virus that was first identified in China, in Wuhan, China last year. It has since spread around the world, and including here in Minnesota, and unfortunately in Minneapolis. It's new. It's a new virus. It's part of a family of coronaviruses that we know cause other conditions, but this particular one is new, and so we're learning new things about it every day. We know that it mainly spreads person to person when you're talking or coughing or sneezing, and when there's close contact, so that respiratory droplets can go from one person to another, which is why we encourage physical distancing. And we know that if you cough or sneeze and it falls on a surface, and then someone touches, puts their hand on that surface and it's still wet, and then puts it to their nose or their mouth or in their eyes, that can be a way of transmitting the infection.
So the best way to stop the spread is to social distance, correct, use all precaution, mask if possible, gloves if possible. Would you agree with that? Cleaning, absolutely.
So I agree, yes, the physical distancing, the 6 feet between people, especially, not necessarily members of your household, but if you are with people that you don't live with, definitely the 6 feet apart, wearing the cloth covers. The gloves are good, but I just say, just make sure that you're washing your hands frequently. I think when people wear gloves, sometimes they forget that the gloves get contaminated, and then they touch the glove, and then they don't wash their hands, and it kind of defeats the purpose. So, you're taking them on properly and not touching the inside of the glove. Otherwise, just make sure that you're washing your hands with soap and water. Soap and water, if you wash your hands for 20 seconds with soap and water, that will kill the virus that causes COVID-19 and any other things that can cause, and other things that may make you sick. So washing your hands frequently is a really good way to prevent disease.
So, Luisa, is it true that it's airborne? I hear a lot of people talking about, like it's airborne or just being out in the air, can cause, if someone just sneezes into the air, I mean, does it linger around or after so long is it just gone? Do you know how that kind of works?
Yeah, so I mean, that's part of the piece of the spacing. When you sneeze or you cough, there's respiratory droplets that come out of your mouth. Even if you don't see them, there's some stuff that comes out, and that will hang in the air for a little bit, but it will fall. It's not like it's going to stay there for a long period of time, especially outside, with the wind and other things. It's, some of these things we're still learning. Mm-hmm. It is not an airborne virus like some, other viruses. So it is in the respiratory droplets, and that is how it's transmitted. We're still learning more about, how infectious is it for how long of time. So, I mean, even though it might be on surfaces, it may not be as infectious because there's not enough of it to really be infectious. But we need to be careful and just be taking the precautions to make sure that we're doing all that we can, so that we're washing our hands and we're staying away, doing that 6-foot separation, and we're wearing our cloth coverings if we're going to be somewhere where there's going to be people around and we're not sure that we're going to be able to keep that distance.
And I'm glad you said that too, Luisa, because there's a lot of misinformation that's out there, mm-hmm. right? And unfortunately, I think a lot of time our society gets our information through social media, and that's not always the best way to get information. And what's important, and since you're from the Minneapolis Health Department, I'm really glad that you're emphasizing that, because it's critical to get the right information so we can get over this and we can beat this thing, and also too to educate the public. So I thank you for talking about that, because I've heard that a lot too as well, right?
Mm-hmm. Yep, and I mean, I'm happy to do it. That's part of why we're here, is we want to make sure that, people are getting the correct information and they're making good decisions based on that information.
So can you tell us about symptoms, right? Because there's a lot of information around that too. What the symptoms are, is it different from a common cold? Other things is that there may not be any symptoms and I can still have COVID-19. What does symptoms look like for COVID?
Yeah, and that varies. So there are some people that, will never have symptoms that they think of as symptoms. They might feel a little bit tired or have some muscle aches or, something very minor, and they don't think of it as symptoms. So, because in a lot of people, this infection will be very mild, but you're still infectious. For other people, they're going to have anything from fever to loss of taste and smell to body aches, fatigue, cough. You could have a congested nose. So you can see how it's confusing. It mixes symptoms that you have with a flu, symptoms that you have with a cold, and allergies. You might just have a congested nose and some coughing, and that is all you have. And if you are someone that has allergies, maybe it doesn't feel that different from your allergies. But you just need to be paying attention, because there may be something else that is a little different, and that would be your indication. But there are, for some people, this is going to be a very mild disease, and you're not going to, it's going to be an inconvenience. But for other people, it's going to be severe. It could lead to hospitalization, and for some people, even death, as we have seen in Minnesota. So, it runs the gamut of mild symptoms to severe, and anything from a fever, chills, muscle aches, loss of taste and smell is one that people have been reporting, cough, shortness of breath, headaches, fatigue, loss of appetite with this disease.
That's a good question because I guess it's not a question, it's a comment. I have the question. So I was going to ask, so if a person has some mild symptoms, right, maybe, it seems like it's their allergies, but is some of these symptoms that you're talking about, is it best to just, treat it like you would regularly treat your allergies or cold? Or, should you be concerned and should you see about getting tested? Like, at what point should you see about getting tested?
If it's feeling, like I'm someone who has allergies, and I take a medication for it around this time of year because everything is blooming, and, I know that if I forget to take my medication, I'm going to have a runny nose, and my throat is going to itch. So if I take my medication like I would normally, and things don't get better, and I'm still having some issues, then I might think that it's something that it's not exactly my allergies. Or if in addition to my runny nose and my tickling in my throat, I'm also having some weird headaches or a body ache or something like that, maybe it's time to look at getting tested. And fortunately, testing is now more available. Okay. So if you are able to call your clinical provider and get tested, I would say go ahead. Okay. Now, even if you test negative, if you're having all those symptoms, you should still take some care because the testing is just going to be that point in time. And with all diseases, with viruses, you're looking for the virus in the body, and you may not have, there may not be enough yet. You may not be enough, your incubation, your viral load has not come to a point where it can be detected. And so, you should keep paying attention to your symptoms and what is happening.
Thank you.
But yes, go ahead and get tested. If you are having some symptoms, go ahead and get tested. If you're completely asymptomatic, you can still get tested, but it's more likely that you might not come up positive.
So if I don't have and thank you for that too, Luisa. So if I don't have a primary care provider, where can I go to get information to get tested?
So the Minnesota Department of Health has a website where they have testing locations across the state, and you can pick your city, and it will it'll give you some places to get tested. So you can pick Minneapolis, and it will give you some places where you can go get tested.
Absolutely, and thank you. And for those folks who want to get that information, you can also call the Department of Health hotline at 651-201-3920, 651-201-3920, and calls are answered from 7 a.m. to 7 p.m. And Luisa, I want to thank you for giving that information. So let's focus and shift a little bit into this, and so for people who test positive. So I've been tested positive for COVID. I've been to my doctor. I've shown all the symptoms. This is what I have, right? Mm-hmm. So who will contact me? Will there be a health official that checks up on me? And talk a little bit about contact tracing and what that means.
Okay. So really what we talk about is case investigation and contact tracing. And so what happens is, so you tested positive, Anthony, your test result is reportable to the state health department because it's an infectious condition, and there's a whole series of diseases that are, but in this case, so they'll get a notification that Anthony tested positive, here's his lab results, here's some information about how to reach Anthony. And right now, up till now, the state health department has been doing all of that follow-up with cases. Now, at the city of Minneapolis, we're going to start doing some of that follow-up for Minneapolis for residents of Minneapolis. But so what will happen is you'll get a call from someone either at the city of Minneapolis Health Department or at the state health department. And what we're going to do is we're going to have a conversation with you about your symptoms, about when you started feeling sick, what led you to go get tested, and how you're still feeling. And hopefully you're feeling better, but, are you still having some symptoms? And then we're also going to ask you some questions about, who you've been in contact with, both before you got sick and after you started feeling not so good, a couple of days before you started feeling not so good. And we're going to ask you to remember, okay, if you were working, who are you working with? Are there people that you are working closely with? And we're going to try to get some information, and we'll follow up with your work to make sure that your coworkers know that they might have been exposed. We'll also talk to you about who lives in your house, and are there people that don't live in your house but that you've been close with and been in close contact with. And then after we get that information, we'll provide you some information on what you need to do. So on what you need to do to self-isolate within your house if you have other people living in the household. If you live by yourself, it's obviously a little bit easier. But what you need to do and how you need, how can we figure out the best way for you to do that, and what can your other members of your household do? And then we will follow up with the people that might have been exposed, your contact. So that's where the contact tracing comes in, is that we get information from you, and then we're going to call your contacts and say, hey, you might have been exposed to COVID-19. We'll not use your name if you don't give us permission to. We'll just say, you might have been exposed to COVID-19, and here's what what you need to do. And so for people that are diagnosed, they need to self-isolate for a minute. You need to be in your house or in your, and by yourself, trying to, as much as possible, not to have contact with anyone. And for the people that are exposed, you need to be quarantined, which is basically similar to isolation. You need to be quarantined for 14 days from the date of the last time you were exposed. So let's say that you got tested, you were positive, and you were able to isolate in your house that day. So anyone that was exposed to you before the day you got tested for a couple of days, they would need to quarantine, and then their quarantine would start from the last day that they were in close contact with you.
And thank you for that information. And we're running up against the clock, Luisa, but I just want to touch on something that you said, and it was about privacy and how do I protect my privacy? Because if I have listeners who are listening in and then say, well, I've contacted COVID, I've got COVID, and now we're going to, do some contact tracing where, I really need my privacy protected. And what you're saying is...
And we do that. I mean, so the information that we gather is only available to the Minneapolis Health Department or the State Health Department, and only if we need to use it to do any work around preventing disease. And then we won't use your name unless you give us permission to. So even when we're contacting, let's say you had some friends that were exposed and some or coworkers, we won't use your name unless you give us permission to. Now, it makes it easier if we have permission to use your name, but we will do the work without using your name if that is what you want. And your information is protected. There's Minnesota state law, the data practices law that protects your information, your private information. So, it is important that people that have been diagnosed talk to us, because that's how we are going to determine who's been exposed and how we're going to be able to provide people the information. So the reason we're doing these calls and following up is so that we can give you information that will help protect yourself, your loved ones, and the community at large. And we all need to work together to get a handle on this thing.
And thank you for that, because it's important. I mean, people in our community are real protective of their information, right? And a lot of times when information is leaked and folks don't want that, there's a stigma around that, and we don't want that either. But we also want to know, folks, that there's no shame into reporting that you have COVID. So, and if I'm protected with my information, and I hopefully that makes folks feel a little bit better. Luisa, we've got about 20 seconds left in this show. I wish this show was longer and you were able to talk more, but in about 20 seconds, just give folks really what are the biggest takeaways that you want people to learn from this conversation today.
So I want people to continue to listen to what to the recommendations from public health. Keep your physical distance, wear your face coverings, wash your hands. And if you're not feeling well, stay home. unless you're going to go out to go get tested or to the doctor. And if, the health department calls you, please talk to us because we want to help.
Great information. Luisa from the Minneapolis Health Department, thank you for joining Minneapolis 360 today. I appreciate you.
Thank you so much for having me.
All right, Luisa.
All right. Bye-bye.
And thank you. And thank you, Kim, as always. This was some good information. Hopefully we can dig deeper with Luisa next time.
Yeah.
But she gave some good information for folks today.
She did. It was imperative that we all understood and knew exactly what COVID is and how we can prevent it.
And where we can go get tested too. And there's no shame in being tested positive because you want to protect you and your family and your loved ones. So
very true.
Again, Minneapolis, I'm glad to be with you today. I will make sure that we are back again next week at 1:00. This is Minneapolis 360. Thank you, Glam Life Kim. I'll see everybody next week.
You're very welcome, Anthony. All right, Twin Cities, it's 30 after the 1:00 hour. On the way next is Zany K with your afternoons. Right after that, Walter Q. Banks with the afternoon drive. It's 89.9 KMOJ, today's R&B and throwbacks. One love, kings and queens.
All right, so the Obamas and a host of their close person
immediately after the car accident.
89.9 KMOJ.
Broadcasting live from Brookdale Health, 5740 Brooklyn Boulevard in Minneapolis.
It's a loud mouth Zany K on 89.9 KMOJ, the People Station, hanging out with the man, Dr. Kent Erickson, over at Brookdale Health, in business for 37 years. But you've been golfing for a lot longer than that, huh, Doc?
Yes, we have been doing a little golfing. I've been out 2 times already with social distancing. We took our own carts. It was kind of a fun time. I think it's good for people to get out. I know some other friends have gone up north and they're did some fishing. Social distancing, so it's healthy, and it's very negative to stay inside all the time and not get out and have some kind of natural air and sunshine on you.
Absolutely. I agree. And with the weather like it is over the next few days, there's going to be a few more chances for you to get out this week, huh?
Yeah, I'll be out a little bit this week. I was going to go Saturday, but I don't know if I want to be out with a high of 50, but I'll get out soon in the next few weeks. So how about you? You a golfer or fisherman? Or?
I am not a golfer. I am a runner, and I like to just hang out on my patio and grill. That is my favorite pastime, for real.
I'm good at that too. You have to compare ribs sometimes.
Absolutely. Now, with all this fun and excitement going on, Brookdale Health is open right now, right?
Yeah, that's the big thing, is that we are open Monday, Wednesday, Thursday, 8 a.m. to 6 p.m., and Tuesdays and Fridays now we're here 8 a.m. to 2 p.m. I've been here for 37 years. We're in the corner of Brooklyn Boulevard and Bass Lake Road, right by the Cub there. And it was a little slow for a while because there's no cars on the road.
Yeah.
So we do a lot of more vehicle crash patients, and we've been helping for many years. We're expert in that, but now people are out driving again, and we're having patients come in who've been involved in those automobile crashes. And it's nice with us is that after 37 years, we know how to fill out the paperwork. We know how to deal with insurance companies. We make medical referrals to doctors that we have confidence in that have helped many of our patients. We make referrals not only to attorneys that we would use ourselves. After seeing over 10,000 patients in our facility, we've got to learn a few things, and this is our specialty.
Absolutely. Brookdale Health, 5740 Brooklyn Boulevard. You can call them and set up an appointment, 763-561-4045. Zany, on with Dr. Kent Erickson. Now, along with seeing patients and having experienced doctors in physical therapy and chiropractic, providing practical treatment for patients, you make sure that things are safe if patients should have to come into the office, right?
Yes, we have a lot of patients are coming to the office, but we're wearing masks. We screen their temperature before they enter the office. They go right to the treatment room. They're not sitting in a waiting room with other people. We screen the people for COVID symptoms. So if they've been traveling, that type of temperature. We take temperatures, not only the patients, our staff all take temperature, and the doctors individually. The doctors are cleaning the rooms after every patient, cleaning the equipment when using for physical therapy. So we'd also had training before this, a couple years ago, so we were already on top of this, but we're at a much higher level now. So people should feel comfortable to come in. But there are patients that do not feel comfortable to come in, and maybe they have a lot of comorbidities where they have other health problems, so they're really better to stay in the house. We added telemedicine. We hadn't had that over the 37 years, but now we're using it on a regular basis. We have a number of patients where they can actually do an examination from at home. We do the physical therapy instruction and have you do the exercises with someone watching. They do it on we can do it on Facebook if you want, Facebook or Zoom, where they actually can make corrections of your exercise, make sure you do them right, don't get hurt. So we have the treatment then that you can use through the phone line now. So that's something new for us, and a lot of patients feel more comfortable with that, and that's fine. So we are using that.
I mean, people are just practicing social distancing. They're trying to stay safe. People are wearing their mask. And when it comes to seeing a doctor, you have an alternative with the telemedicine at Brookdale Health, located 5740 Brooklyn Boulevard. Get the ball rolling at 763-561-4045. Dr. Kent Erickson. Did I forget anything? Did I leave anything out? Anything else you wanted to mention?
Our hours, Monday, Wednesday, Thursday, 8 a.m. to 6 p.m., and Tuesdays and Fridays, now we're here 8 a.m. to 2 p.m. So if you're having an issue, a health issue, acute problem, motor vehicle crash, we probably having neck pain and headaches and mid-back pain, shoulder pain, give us a call. This is what we do.
Yep, set up your appointment now, 763-561-4045. Dr. Kent Erickson, enjoy some golf this week, and we'll talk to you next time.
Okay, thank you, Zany.